Well, you heard the names, Advil, Motrin. Both types are ibuprofen, a pain medication that some people actually reach for daily. Dr. Kohli joins us this morning to discuss recent research that shows they could lead to heart failure in some people, though. So, Dr. Kohli, thank you for being with us, because you're right. This is used by some people, maybe a little too much. Can you tell us what the research now shows?
Yeah, so Jordan, we know that patients that are diabetic have twice the higher risk of heart failure. We know that patients that use non-steroidal anti-inflammatories, or NSAIDs as they're called, like ibuprofen, Motrin, Advil, they can have a higher risk of heart failure. So this study looked at diabetic patients using NSAIDs, and the results were quite shocking. In fact, just a month of using NSAIDs could actually land you up in the hospital with a 43% higher risk.
And why does this specifically affect diabetics in a different way?
So diabetics, because of the high sugar that they have, their heart is sort of prone to heart failure. But what we think is that it's not just diabetics, it's actually even regular people that have a significantly higher risk of heart failure. So if you think about what non-steroidal anti-inflammatory drugs do, is they shut off all kinds of inflammation. Now, usually inflammation is bad, but certain other effects that they have is they make your body hold on to sodium, so they can raise your blood pressure. They can affect the lining of the blood vessels, so they can cause increased risk of bleeding in the stomach. They can raise, your blood pressure. They can increase risk of the work that your heart is doing, and they can change the electricity in the heart as well.
And I want to stay focused on that group of diabetic patients. Are there any patients that are at a higher risk than others?
In fact, they did find that certain types of diabetics, now these are diabetics that are older, over the age of 80, diabetics that have more poorly controlled blood sugar, so their hemoglobin A1C or their blood sugar control is a little bit worse, or diabetics that have actually never used NSAIDs before. So the first time NSAID users actually had more than 2 times higher risk.
What about people without diabetes? Because there is something to be said there as well.
That's right. So even for people like you and me who are healthy, non-steroidal anti-inflammatory drugs are dangerous. They are not a safe medication to use just because they're over the counter. And of course, then you throw in all the people that have chronic kidney disease, that have high blood pressure or hypertension, they have arrhythmias like atrial fibrillation, they've had bleeding in their stomach. These are all major risks of non-steroidal anti-inflammatories, and people think just because they're available over the counter they can use them without those risks.
So I just came back from surgery, and of course that was one way to cut down on using painkillers, was to rotate back and forth between ibuprofen and Tylenol. What is an appropriate way to use these medications? Because we do know that doctors do recommend that, so we're not saying never take it. Just make sure you're doing it in a reasonable amount.
That's right. Just be very mindful. So what we say is the lowest dose for the lowest duration necessary. So you don't want to be just taking one every day just because it makes your back feel better, because that's not good for your organs and it's not good for your long-term cardiovascular risk. But if you've had surgery, if you've had something else that makes you cut down opioid pain medications that you would use, certainly it's very reasonable to use. Try to minimize the dose that you need. So taking 800 milligrams may not be necessary. Maybe you take half that, or just take 200 milligrams, which is a single tablet. Also, what I recommend is that you talk to your doctor before you start on any kind of ibuprofen or non-steroidal pain regimen, because they're not all created equal. So certain non-steroidals increase risk of GI bleeding or increase risk of cardiovascular complications compared to others. So if you have had GI bleeding or if heart disease, your doctor may recommend Celebrex rather than ibuprofen or Advil, or they may recommend naproxen rather than one of those others. So which one you use also matters, along with the duration and the dose.
Moral of the story remains the same no matter what topic we're talking about. Talk to your doctor before you do anything. Dr. Kohli, as always, we appreciate you being with us.